Hello everyone, welcome to our Windstroke webinar brought to you by Lamp AccuWellness Foundation Inc. as part of its ongoing Lamp Lectures series. The aim of this webinar is to provide an overview of what strokes are and why they occur. You will learn about stroke causes, symptoms, TCM and acupuncture treatment and recovery and preventative measures, as well as what to do if you encounter someone on or offshore who is having a stroke. Today, day 1 of 9, our learning objectives are: what are strokes and why do they occur, the causes and types of stroke, symptoms of a stroke, and how you can help if you recognize that someone is having a stroke. Windstroke, chung fung. The Chinese term refers to pathogenic factor involved, as feng means wind. It is therefore apoplexy caused by internal wind. Most of us know how it feels to have our faces slapped by a strong wind, or the eerie sensation that arises when it howls so loudly and violently the whole house shakes. But we also know the pleasure of a soothing breeze on a hot day. Wind in and of itself is not some inherently evil spirit, as some may suggest. Its impact depends upon the constitution and resiliency of the landscape through which it blows. And like anything, the value we assign to it depends on the scope and slant of our perspective. Humans as nature. In the ancient metaphysics which inspire and permeate Chinese medicine, human beings are understood as elements and incarnations of the natural world. We are a microcosmic embodiment of the earth, and by extension, the entire universe. The patterns that transpire in the human body parallel and resonate with those that exist in nature. All forms of being on earth are simply unique manifestations of one universal chi, the substratum of the cosmos, the essential quality of being and evolving. Due to this shared resonance, humans are easily influenced by the outside world and vice versa. One might say they mirror or mutually engender one another. Rather than a linear model of cause and effect, Chinese medicine explains the synchronicity of phenomena through a system of correspondences in which cause is the effect. From this vantage point, we can better understand the language used in Chinese medicine to elucidate health and disease. States of illness are akin to patterns of poor weather in the landscape of our bodies and are named as such. Often, our disharmonious internal climate resembles the current external atmosphere, in which case we might say that we have been impacted by an external pernicious influence, such as wind, cold, and dampness. These influences can both designate cause of disease and serve as names for patterns of stress in the body. The most virulent of the climatic forces that provoke disharmony in the human body is wind. It, like all the external pernicious influences, is seen as both an influence as well as a manifestation of disease, the cause and the effect. Wind is considered the spearhead of all disease, for it serves as a vehicle to carry other undesirable influences into the body. Yet, it's worth noting that with a shift in perspective, wind can also be regarded as the spearhead of all growth. A disorder that Western medicine deems unexplainable may be thought of as a wind condition in Chinese medicine. Wind can invade the body from the outside. We call this external wind, predominantly disturbing the lung qi, or be generated internally, the internal wind, where it primarily agitates the liver qi. When we are vulnerable, external wind often penetrates the body through the back of the neck, So, wearing a scarf and staying bundled up in windy weather can help us keep us well. Once wind has entered the body, acupuncture treatments can help to release it and harmonize the qi to prevent future disruptions. Wind is at play in disorders involving abrupt appearance and disappearance, like acute disorders such as cold and flu, or what biomedicine would consider infectious or contagious diseases. Excessive or spasmodic movement, migratory symptoms such as rheumatoid arthritis, skin disorders such as eczema, dizziness, pain, upper and outer portions of the body, the face, skin, lungs, nervous system impairment such as epilepsy or Parkinson's, impulsivity. As the emblem and instigator of change, wind is a constant force in our existence, one we habitually respond to in an effort to maintain balance. Our perception of its motive, as invasion or invitation, the nature of our response, and our internal landscape accounts for any symptoms that may arise. Our internal milieu, including immune health, as well as our relationship to change and chaos, influences how wind affects us. When our defenses are compromised, or we insist on control, wind's penetrating, capricious, urgent nature renders us more susceptible to its fickle threat. The inner wind that is due to a yin and yang imbalance is called internal wind that rises in the liver and is characterized by change and movement. It is not as strong as external wind and attacks internal organs only when they are weak, resulting in symptoms of internal involvement. Internal wind in TCM is caused by one of the following patterns: liver yang rising, extreme heat, liver yin deficiency, liver blood deficiency, or body fluids deficiency. Treat the pattern, eliminate the wind. Liver yang upper rising, stirring wind. There will be tremor, dizzy, mouth deviation, hemiplegia, sudden fainting. Extreme heat induces wind, as in febrile acute disease, convulsion, spasm, high fever, delirium, coma. Liver yin deficiency generates wind. There will be twitching, cramp, tremor, involuntary limb movements, on and off. Liver blood deficiency generates wind, numb skin and muscles, thick, tense muscles. Body fluids deficiency generates blood dryness, so there will be dry skin, itchy skin, scaly, flaky skin. Jung indicates sudden onset of this condition because the character Jung conveys idea of an arrow hitting the target. Windstroke in Chinese medicine corresponds to two possible Western medical conditions: non-traumatic intracerebral hemorrhage, ischemic cerebrovascular syndromes, which includes ischemic stroke and TIA. In Western medicine, these two conditions come under the term cerebrovascular accident, or CVA, a pathological state of the blood vessels in the brain. Sudden neurological impairment caused by a CVA is called apoplexy in Western medicine and is popularly referred to as stroke. Non-traumatic intracerebral hemorrhage includes intraparenchymal hemorrhage and subarachnoid hemorrhage. Intraparenchymal hemorrhage is a condition resulting from the rupture of a blood vessel in the brain, causing intraparenchymal bleeding. It can be classified as either primary or secondary to arteriovenous malformations. Intraparenchymal hemorrhage is the most devastating and disabling type of stroke, characterized by focal neurological deficits made worse with hematoma expansion. An early altered level of consciousness is often observed and associated with vomiting, headache, and epileptic seizures. Subarachnoid hemorrhage occurs when there is bleeding around the brain into the subarachnoid space, which is usually filled with the cerebrospinal fluid. The subarachnoid space is the interval between the arachnoid membrane and the pia mater. It is occupied by delicate connective tissue trabeculae and intercommunicating channels containing CSF, or cerebrospinal fluid, as well as branches of the arteries and veins of the brain. The cavity is small in the normal brain. Bleeding usually comes from a burst or ruptured aneurysm or arteriovenous malformations. A brain aneurysm is a bulge or ballooning in a blood vessel in the brain. An aneurysm often looks like a berry hanging on a stem. A brain aneurysm can leak or rupture, causing bleeding into the brain. So this is hemorrhagic stroke. Most often, a ruptured brain aneurysm occurs in the space between the brain and the thin tissues covering the brain. This type of hemorrhagic stroke is called subarachnoid hemorrhage. A ruptured aneurysm quickly becomes life-threatening and requires prompt medical treatment. Most brain aneurysms, however, don't rupture, create health problems, or cause symptoms. Such aneurysms are often detected during tests for other conditions. After clinical assessment, a non-enhanced cranial computed tomography, or CT scan, is the investigation of choice to be performed as soon as possible. Ischemic cerebrovascular syndromes include ischemic stroke and transient ischemic attack, or TIA. Ischemic stroke is syndrome characterized by the rapid onset of symptoms and signs ascribable to focal neurological deficits. No cause can be identified except for the vascular component. When an area of the brain is damaged from a stroke, a loss of brain function may occur. In the most severe forms, such a loss may affect the entire brain. We call this global ischemia, with subsequent coma caused by widespread injury. Ischemic strokes may be caused by hardening of the large cerebral arteries, or atherosclerosis, occlusion of the small arteries, cardiogenic or aortic embolism, and rare mechanisms such as vasospasm or sympathomimetic drugs. In very few cases, the exact cause remains unknown. Transient ischemic attack is a transient episode of neurological dysfunction caused by focal brain ischemia without permanent brain damage. Acute brain ischemia is considered to be present in patients presenting with a rapid onset focal disorder of motor or sensory function, aphasia, dysarthria, and altered state of consciousness. Wind stroke, or chung fung, indicates apoplexy, which is sudden diminution or loss of consciousness, sensation, and or neurological impairment. From a TCM theory perspective, stroke is related to liver, spleen, kidney systems. Predisposing factors for stroke may take years to develop and are often the result of emotional and physical strain, overwork, poor diet, and lack of relaxation. These lifestyle habits deplete the body of vitality, which often leads to accumulation of phlegm and or wind. Over time, these internal factors of phlegm and wind build to varying degrees and may culminate in a stroke. Wind stroke. Chinese medicine plays both a preventative and a rehabilitative role. Stroke is a condition where blood supply to the brain is disrupted, resulting in oxygen starvation, brain damage, and loss of function. It is most frequently caused by a clot in an artery supplying blood to the brain. It can also be caused by hemorrhage when a burst vessel causes blood to leak into the brain. Stroke is a condition where blood supply to the brain is disrupted, resulting in oxygen starvation, brain damage, and loss of function. It is most frequently caused by a clot in an artery supplying blood to the brain. It can also be caused by hemorrhage when a burst vessel causes blood to leak into the brain. Stroke has already reached epidemic proportions. Globally, 1 in 4 adults over the age of 25 will have a stroke in their lifetime. 12.2 million people worldwide will have their first stroke this year, and 6.5 million will die as a result. Over 110 million people in the world have experienced stroke. The incidence of stroke increases significantly with age. However, over 60% of strokes happen to people under the age of 70, and 16% happen to those under the age of 50. One of the main clinical risk factors for stroke is high blood pressure as a result of atherosclerosis. There are many other risk factors, including tobacco use, physical inactivity, unhealthy diet, harmful use of alcohol, atrial fibrillation, raised blood lipid levels, obesity, genetic disposition, stress, and depression. Knowing the signs of stroke and seeking immediate emergency medical care can save lives and improve the outcome for survivors. The key signs of stroke are facial drooping, arm weakness on one side, speech difficulties, slurring or not making sense, and people may also experience changes in their vision and loss of balance or dizziness. We have here some data from the Lancet Neurology. The annual number of strokes and deaths due to stroke increased substantially from 1990 to 2019, despite substantial reductions in age-standardized rates, particularly among people older than 70 years. The highest age-standardized stroke-related mortality and daily rates were in the World Bank low-income group. The fastest growing risk factor for stroke between 1990 and 2019 was high body mass index. Without urgent implementation of effective primary prevention strategies, the stroke burden will probably continue to grow across the world, particularly in low-income countries. According to the latest World Health Organization data published in 2020, stroke deaths in the Philippines reached 74,167, or 11% of total deaths. The age-adjusted death rate is 104.08 per 100,000 of population, ranks Philippines number 66 in the world. Stroke remains the leading cause of disability and death in the Philippines. Evaluating the current state of stroke care, the needed resources, and the gaps in health policies and programs is crucial to decrease stroke-related mortality and morbidity effectively. The Philippines is an archipelagic nation with over 7,100 islands, divided into 3 major island groups, Luzon, Visayas, and Mindanao, with its capital Manila located on the largest island, Luzon. With over 109 million Filipinos living in the country, its population is generally young, with almost 40% belonging to the age group below 19 years old, and only 5% are aged 65 and above. From 2009 to 2019, stroke remains the second leading cause of death and one of the top 5 leading causes of disability in the Philippines. The true stroke prevalence is uncertain, but reported estimates vary between 0.9% in 2005 to 2.6% in 2017 of the population. Based on types of stroke, 7 out of 10 cases are diagnosed as ischemic, while the other 3 are considered hemorrhagic. 36% of the total stroke deaths are not attended by any medical personnel. Thank you very much for your attention.